Hello, good afternoon. My name is Jara and I'll be your student nurse today. And I will be assessing my patient's eyes. Today I will be gathering all my equipments needed. I have a pen light, a Snellen's chart, an opaque card, and my chart and my pen. So first, I will be hand washing using my alcohol-based sanitizer. And I will be doing this for my patient. I haven't seen this patient before, so this is the first time my patient's gonna visit this clinic. So I don't have any records for her, so I will basically ask her some questions before we start. So I will verify also her name and her date of birth. That way I know that my patient is the correct patient. Hi ma'am, my name is Jara and I'll be your student nurse today. May I verify your name and your date of birth, please?
Jesse Santos Borzon.
Alright, and what's your date of birth?
February 3, 1982.
Thank you. And just verifying your age?
39.
Alright, perfect. Thank you. So today I will be doing an eye assessment for you. I will be having you, do some different positions, and also I will be having you, I will be directing you following my instrument, or I will be putting some light on your eyes as well, okay? So first, you would like to also explain to the patient what you're going to be doing, provide the patient some privacy by closing the windows and the door, and you would like to check with the patient if they're feeling comfortable, and also explain to the patient what you're going to be doing. So today we're doing your eye assessment. I just want to make sure that everything is normal. We're doing this just so we could check if your eyes are symmetrical, if there's any abnormalities present, any abnormal colors or size on your eyes, your pupils. Just want to make sure that everything is looking healthy, okay? So first, you would like to ask the patient to check if they are wearing any corrective lenses or glasses, and if they do, you can put that data in your sheet, and you can have the patient take out their glasses if you're doing the assessment for them. So ma'am, do you have any corrective lenses or any reading glasses?
No.
Okay, so good. So first I would like the patient to stand, and you want to let the patient read the Snellen chart. That way you would see if the patient's eyes are in good vision. So you would like to put the Snellen's chart here. And then, ma'am, can you please stand up here about a few feet away from the chart? So usually about 20 feet. I want you to please use this opaque card to cover your left eye, and then you can read the letters from the chart.
E, F, E, T, O, Z, L, P, E, D, P, E, O, F, D.
Alright, thank you. And please transfer the opaque card to your right eye, and just please verify the letters in the chart.
E, F, E, T, O, Z, L, P, E, D, P, E, C, F, D.
Thank you. Alright. So, thank you so much. You can go ahead and have a seat right here. So now you want to check the patient's eyes in the outer structure, if there's any swelling, inflammation, or any redness or any discoloration on the structures. You want to check their eyelids if there's any inflammation, or if there's any pus or anything that's coming out from their lacrimal glands or in their eyes. And you want to check the color of their conjunctiva, which is light pink. You want to check also their cornea and their pupil, if they're equivalent in size. Their iris and all the structures in the eye should be symmetrical. Otherwise, you have to document that data if you find anything that's abnormal. So now I'm going to be testing if your eye is, if there's any irregular movements of your eye. I want you to follow this pen here wherever I point it to, and then just follow it accordingly, okay? All right. All right, thank you. So I don't see any irregular movements on the eyes, which is good. It's a normal finding. So I want you to also see and follow this pen. I'm gonna point it to your nose. So usually the eye is going to be crossing over as when you put it closer to her, which is a normal reflex on the eye. So everything is looking normal. Now I'm going to be doing my, I would like to check on your pupils if they are dilating and constricting accordingly. So you want to turn off or dim the lights. If you don't have access with the lights, sometimes in the hospital you can always put your folder on top of the patient's head, just so they could so that the ceiling light's not reflecting on them. So for this one, I'm going to be dimming the light, and then I will be checking the constriction of the pupil. But you don't want to direct the light towards the eye. You want to come from the side. That way the eyes will be comfortable. All right, so I just want you to look at me, and then I'm just gonna pass by the light on your left eye, okay? All right, see, I could see that the pupils are being constricted when I put in the light towards her eye. Usually the size of the pupils should be about 3 millimeters to 5 millimeters. And then when they constrict, it would be about 1 millimeter. So I could see that her left eye is constricted when I give her direct light. And then now I'm gonna test the right eye. So just look into me. All right, so the right eye is also the same. It constricts when I give her the light, when I point the light to her eye, which is a good sign that they are dilating and constricting. So when it's dim light, the pupils tend to dilate, and then when you put in some light, it constricts. All right, so for this, I think everything is looking okay. There's no purulent or pus coming out from neither of her eyes. Her sclera is white and normal. There's no redness. Her pupils are functioning well. They constrict and dilate, and nothing on her eyelids. There's no inflammation or anything like that. So for this assessment, my patient seems to be normal. And if you have any findings, please document that in your chart, and then you can always refer to the physician for any support or any referrals for any abnormalities seen to the eye. All right, so I'm going to be doing my hand hygiene technique again. And check with the patient, is everything doing okay? Yeah. So are you feeling comfortable with everything?
Yeah.
All right, so if there's any findings, we'll just give you a call, but everything looks good. So that will be all for your eye assessment. All right, thank you so much. So you can dismiss the patient now.